World Health Organization estimated that around 6 million people die every year, with more than 5 million as a result of direct tobacco use and 600,000 as a result of secondhand smoking. It was estimated further that tobacco consumption kills 10 Filipinos every hour due to tobacco-related cancer, lung, and cardiovascular diseases. In spite of the alarming statistics and relentless efforts of the government and non-government organizations on tobacco smoking awareness, cessation, and rehabilitation, tobacco smoking is still prevalent across nationality, race, gender, and age.
Universities, as source of knowledge for innovations and as part of the community, is in the best position to complement the persistent effort of various public and private agencies in addressing tobacco-related problems. Hence, in this developmental project, we ask, how can universities advocate tobacco smoking prevention, cessation, and rehabilitation?
We offer cigars.
This project, titled Cigars, a community and campus-initiated goals on awareness and rehabilitation towards smoking, a smoke-free act, seeks to develop a tobacco control and rehabilitation project with universities as primary leaders and advocates. This developmental project shall include a technology-empowered tool for tobacco control, awareness, and rehabilitation, focusing on smoking behavior that will enable target end users such as students, teachers, health workers, local government units, and smokers in the community to inform the university and its neighboring community of the harmful effects of smoking, targeting active smoking individuals to assist them in quitting.
Our project, titled Cigars, a campus and community-initiated goals on awareness and rehabilitation towards smoking, a smoke-free act, will focus on developing an innovative strategy will address the pressing needs on smoking initiated by a campus or university that will work hand in hand with the community. This will facilitate a collaborative effort that will increase the chance of achieving our goals on tobacco control and smoking cessation through the development of a technology-empowered tool.
First is the Life Watch. The intention of this device is to provide continuous public health education to smokers and non-smokers on the direct and indirect harmful effect of smoking. This will serve as a wake-up call and a motivating tool to elicit a change in behavior towards smoking. This device will also enable the user to monitor himself or herself that facilitates self-awareness behavior. According to studies, consistent reminder of the negative effects of smoking increases awareness and perceived harm, thereby causing a change in behavior or attitude towards smoking uptake.
The biographic data of the user will be encoded in the life watch, such as name, age, sex, smoking or not, amount of exposure, and or the amount of cigarettes smoked per day. This data will serve as a baseline information. The data generated for individuals will be analyzed and will serve as their lifespan meter.
The Life Watch will generate a baseline lifespan meter. This lifespan meter will be calibrated based on the behavior of the smoker. Each time they smoke, depending on the number of cigarettes, the line on the meter will decrease. Meaning, the more they smoke, the lesser their lifespan will be. On the contrary, the benefit of this Life Watch is that it will prompt the user on the advantages for a change in behavior. A gradual decrease in the number of cigarettes smoked per day will increase the line on their lifespan meter until they quit smoking.
This Life Watch will also be programmed for the non-smokers. Caleta mentioned in their study, preventive measures are necessary to discourage young people from smoking uptake and address the misleading perceived harmfulness of smoking.
For the design, development, and implementation phase, the team will adopt the Agile framework for the Life Watch, which is a continuous learning process in technology development.
The evaluation phase. In line with our proposal theme, Cigars, a smoke-free act, We will be using the word smoke-free for our evaluation phase. The rationale for this is for the community to remember the word smoke-free as a process which aims to have a smoke-free environment initiated by the communities and university in the Pacific Rim.
Another part of this project is the eCampus Counseling Hub, or ECC Hub. According to the World Health Organization, problem about smoking will not decline if the smokers are not convinced to quit. Survey reports show that approximately 1/3 of smokers attempt to quit each year, and that majority of these attempts are undertaken without help. ECC Hub is an interactive counseling hub facilitated by the university. This program aims to provide accessible and professional counseling services, information dissemination, and health education to those individuals who want to quit smoking.
We will follow the Proceed-Proceed model for this project. The Proceed-Proceed model offers a comprehensive structure for assessing health needs which are necessary for designing, implementing, and evaluating public health programs. The Proceed component consists of series of assessments, while the Proceed component focuses on pilot testing, implementation, and evaluation of the strategies, outcomes, and mediators. Initially, a project management committee and technical working groups will be created to oversee the planning, implementation, and evaluation of this project. This will be followed by the Proceed phase, where different assessment techniques will be facilitated to enlighten the researchers, the university, the community regarding the extent of the problem, enabling and disabling factors that may affect the project, and finally, the available human, technological, economic, and educational resources. We will utilize a pragmatic mixed method approach in order to come up with a sound plan.
Data from surveys, focus group discussions, key informant interviews, literature, and document reviews will be utilized. The specific assessment strategies consist mainly of social assessment among the members of the university and neighboring community to ascertain the health promotion needs and cultural appropriateness of the proposed tobacco control and rehabilitation project.
Year 2 marks the technological development of this project. We will follow the Scrum software development model for the hardware and software development. Scrum is an incremental and iterative development framework that uses empirical approach of continuous refinement. We will develop the Lifespan Meter, LifeWatch, and ECC Hub social media platform. Alpha prototype will be deployed to pilot users, primarily to ascertain the accuracy of the technology. Bugs and appropriate fixes will be documented and will be used for the revisions. Afterwards, the beta prototype will be deployed for the second round of pilot testing. Once again, bugs identified will be fixed and production units will be produced for full implementation. Part also of the Year 2 is the training component, wherein end users from the university and community will be mentored about the CIGAR project and the technologies to be utilized. This training will also serve as an opportunity to engage, collaborate, and build community of champions among members of the university and community.
Year 3 will include the second evaluation portion of the Proceed component. This focuses on the continuous engagement with relevant stakeholders and field implementation. Tobacco control and rehabilitation will facilitate it. The project will be evaluated. Results and experience after the intervention will be tested in terms of change in behavior, usability, applicability, and cost efficiency for the university and community.
First, process, impact, outcome, and economic evaluation using mixed method design. Second, continuous lobbying for the policy development in the use of innovative technology and social media in tobacco control and rehabilitation.
Efforts to reduce, control, and reverse the effects of smoking have been initiated, yet it remains to be a pressing health concern, not only in our country, but across the Asia-Pacific Rim and worldwide. Innovations such as the CIGARS project successfully merges with technology and human intervention that both deliver.
Together. One university, one community. Smoke free, breathe free.